Hi, everyone. This is Gabe from Arch, and this is Positive Impact. And today I have Molly Brinkmann, Dr. Molly Brinkmann. Uh, Molly, you want to introduce yourself?
Sure. Yeah. My name is Dr. Molly Brinkmann. I am a small animal general practice veterinarian. I am the medical director of a practice in Franklin, Tennessee, which is pretty close to Nashville.
And for very obvious purposes, we wanted to speak to you so we could give some tips on animal nutrition as well as some stuff that maybe most of the general public doesn't know. So for the first couple things, what are your first thoughts on animal nutrition DIY? It's becoming pretty popular. Yeah, just what's your 101?
So, animal nutrition DIY is a bad idea, first of all. Um, there are ways to cook for your pet that are safe and healthy, but it requires a lot of time and dedication, and it also requires consultation with a veterinary nutritionist. And a lot of people don't realize that. There are a lot of recipes for dog or cat food on the internet, like on Pinterest, and people think, oh, if I just get some protein and some vegetable in there, like we're going to be good. But you won't be good. And the problem with nutrition is that it takes years sometimes for a nutritional deficiency to actually cause a problem that's visible in a pet or any living being. And so people are like, well, I've been feeding my dog just chicken and rice for a long time and they're fine. And they can be fine for a while, but then it will cause a problem because they're missing important vitamins and minerals and amino acids and different things. So we do, as veterinarians, offer services to refer our clients to nutritionists to formulate diets for people. And there's very specific science that goes into that. You will pay for the consultation to do that. You have to measure and weigh items. You have to usually add a very specific supplementation to the food. So it's very complicated to actually DIY dog food.
I don't know nearly enough as I probably could or should, but it's a very complicated process. So like when our company was formed, we were spending as much time reading as possible to try to figure out what a balanced diet would be like. And we had pretty early on, we realized that maybe going with a certified nutritionist and a few vets was probably a better idea than whatever we could write on a piece of paper. Um, so definitely feel it. Uh, I think I'd maybe take a step back, and I'd love to hear about how you founded your practice and what brought you into the veterinary world.
I have actually been a part of this practice since about 15 years ago. So before I went to vet school, I worked at this practice as an assistant. And so I have known a couple of the doctors and some of the staff there for a long, long time. So I worked there. Then I went to vet school. I've worked in other jobs the last 8 years or 9 years, I guess. And so I've come back to this practice in the last year and a half, and now the medical director. So I do have a leadership role and a management role, but it's a very busy, privately owned small animal clinic. We see a ton of patients, and we have wonderful clients, and it's 47 years old. So we have a very established presence where we are, and a lot of clients, some of them have been there for 47 years. So it's a pretty cool place to be. Yeah.
I love it. Would you have any quick tips on things that like what is a common thing that you run into, right? When people bring their pets in, there's a lot of, I guess, well, do you all have a what's the word I'm looking for? Like an emergency relief or like something where people, yeah, that type of practice.
Yeah, so veterinary medicine has changed a lot. It used to be that your local vet kind of did everything for you. If you had an emergency at night, they were on call, you could call them. But now we have emergency hospitals, and now there are urgent care clinics available in a lot of like larger areas. So here in Franklin, we do have all of the above. So we do have ER facilities. There's a couple different clinics that are available 24/7. And then we actually do have a couple urgent care clinics in the area now. And so those clinics are open just kind of like in human urgent, like walk-in care. They're open from the afternoon till late at night so that when your vet is closed, you can go there.
Awesome. Is there anything that you're seeing? I guess like anything, any trends that you'd like to use the platform to make people aware of?
Spring is quickly turning into summer, at least where we are. It's getting hot. And so heat stroke is starting to happen. So we're starting to see dogs, especially brachycephalic dogs, so dogs that have smushy noses and faces, they get overheated really easily. And because their respiratory system is not great to start with, they can go into respiratory distress and get overheated, and it can be fatal. So that's something that we always watch for this time of year. I always tell people, especially if they have dogs that are brachycephalic, they want to make sure they're not getting overheated. So if it's over 75, 80 degrees outside, that can happen very quickly. And so we want to limit their time doing exercise or activity outside. These are air conditioned dogs for the summer, so they need to stay in where it's cool. Um,
It occurs to me, so being from North Carolina, there's a whole spring seasonal allergy season comes around where it's just like so much pollen.
it's bad. It's the same here. It's very bad right now. I'm seeing a ton of dogs with allergies. So chewing, licking their feet, chewing their rear end, having ear infections, and then just generalized skin issues and scratching. Those are the like telltale signs of environmental allergies in dogs. They're extremely common, and thankfully your vet office has a lot of things they can help to ameliorate those signs and secondary infections and hopefully tackle the underlying problem, which is the allergy.
Love that. Plug for local vets to help with these seasonal allergies.
Go before it gets bad. A lot of people wait. They're like, yeah, they've been digging at their ear for a month. They've been scratching. And by the time they come to us, they have these horrible secondary infections. And so then we have to spend a lot of time treating that before we can get everything settled down. So early is best with allergies for sure.
I've always had this question, and this is one that I should have a better answer on. How do you know what the exact cause is? So, like, let's say a dog comes in, he has some type of reaction. Are there any tests that you all run? Just like walk me through that little that. Yeah.
There's only one way to actually stop the allergy, the allergic reaction to the environmental things like pollen, and that's to go to a dermatologist and get immunotherapy, like allergy shots at people. And for a lot of people, that's a difficult thing because of financials or time and commitment. So there's a lot of other things we can try. But when I see a patient who has symptoms of environmental allergies and secondary infections, what I'm going to do diagnostic wise is swab ears if they have ear issues to look at the cause of the ear infection. So we want to know, is there yeast overgrowth in the ear or is it bacterial overgrowth? And then what kind of bacteria? And that's actually a lot of information that we can really quickly and honestly easily gather in just a general vet clinic. It's really nice. We get a swab, we swipe it on a microscope slide, and we look under the microscope. And in about 5 minutes, we do stain the sample. And then in about 5 minutes, we can tell you, is this infection caused by yeast or bacteria? And if it's a primarily yeast infection, an overgrowth of yeast, that usually is an indication that this is probably an allergic component because the inflammation from the allergies change what is going on the inside of the ear canal. And that's what sets up for that overgrowth of yeast. So that's a really helpful little piece of information that we can get.
What trends in sustainability are you enjoying right now? Are you seeing the overlap into the pet space, and just talking a little bit about that side of things?
I didn't come here to plug Arch, but loved I love Arch. So Ashley is who introduced me. My manager Ashley told me about Arch. Was like, you got to try these. This really cool. This company, and so we use the Better Biscuits in our practice. So anyone that's watching this probably knows somewhat about Arch, but environmentally friendly products and sustainable use of alternative protein sources. So I love that part of what Arch is doing, but I also love the hypoallergenic component to it because we see so many pets who do have allergies and may have sensitivities to certain foods like chicken, and chicken is in so many dog treats and products. And so we keep Better Biscuits on our shelf in treatment so that if we need to give a pet a treat, that is what they get, because it takes away some of the worry that, oh, am I giving them a treat that's going to irritate them because they have an allergy? Crickets are a novel protein, meaning dogs have probably not eaten like a concentration of crickets before, maybe a random one in the yard. But so usually their immune system is not going to have a reaction to that. And so that's why, so yes, it helps the environment. We love that. We love to see it. But practically in clinical practice in a vet's office, I think everyone should have better biscuits in their treatment area because it solves a lot of problems.
Wow. We're gonna put a little disclaimer on the bottom, like did not ask Molly to say.
We did not, I promise. But that is what we do. I have pictures. And like, so, sometimes someone will be like, oh, yeah, they don't like the crickets today, or this dog loves the crickets. And people that don't know about, they're like, the crickets, what are you talking about? I'm like, look at these treats.
This would be a good. We're doing the invasive fish, silver carp, Asian carp kopi, and we're making cookies of those too now. So we're expanding into more food sensitive, friendly, sustainable proteins. So listen,
I love it. My dad actually loves the fish one because my dad is a fisherman, and in Tennessee, we crappie is a fish species that is very popular here. It's a delicious fish to eat, and my dad is like a very experienced expert crappie fisherman. But there are invasive species of carp in our lakes and here now, and they are affecting the crappie population. And my dad is very upset about it. And so when he found about this treat, I told him because I knew he would appreciate it. He was so excited about it.
this is such a thing, by the way. The fisherman community, I didn't realize how many people were fishermen. Is like I think maybe my first note. And then like as you talk to more and more folks, and they happen to be fishermen, they're like, invasive carp. They're ruining everything.
And the best part is like it's a lot of like good old country boys who are like up in arms about like an environmental issue, and it's like, yeah.
I know it's remarkable. It means like there's just as much interest on the fish in Missouri as there is in Chicago or Seattle and Kansas City. It's really interesting. Right, we're almost at time, and I want to make sure I ask about two things. One, we didn't talk about the free wellness clinic.
We should totally talk about the free wellness clinic. Okay, and if we go over, it's fine with me. There is a nonprofit that already exists for humans in Nashville. It's called The Store. It was founded by Brad and Kim Paisley. They're really awesome people. But it is a free grocery store program. And so it's not like a walk-up grocery store. It's a program for families who are actually part of their whole organization. And these families, a lot of them are immigrant families or just people who need just some extra help, especially with groceries. We all know the cost of groceries right now is exorbitant. And so they have a facility it looks like a grocery store. It is a grocery store. And their products are either donated or the funds are donated to purchase them. And local farmers also donate produce for their store, which is great. I mean, they have a ton of produce. And our wellness clinic isn't really about the grocery store, but that's the organization that I have sort of teamed up with. Kim and I sort of connected on social media. We started talking. I wanted to get involved with the store. And I was like, oh my goodness, what are you doing for these families' pets? So they do have like a little bit of pet food, but that's about it. So we have dug in and we are having a free wellness clinic for these families' pets on June 1st. And so we are gathering some amazing sponsors and help. Arch might be a company helping us with it, but we're so excited about it, and we're going to provide wellness exams, vaccinations, preventatives, heartworm, flea, and tick preventatives, some dog and cat food, and for all of these pets, we also have some local specialists, veterinary specialists, who have donated some pro bono work if we find patients that need specialized surgery or treatments. So I am very excited about it, if you couldn't tell.
And then the last one, and I saw this in like I'm going to London this week, so I was like, it's in the Daily Mail.
Oh no.
Kate, you already know. I saw that you're yeah. There's a lot of conversation about how you're a Kate Middleton lookalike.
Oh my goodness. So a very, very nice sounding person from this news source called me and we did a phone interview. She asked me a few questions. And then in a few days, there was an article about Kate Middleton's American lookalike, who is a vet, on social media. The wording in the article was very interesting. There was a lot of expansion beyond what I actually said. I think, yeah, I think she said like that I told her people stop me in the street all the time and ask me if I'm the Princess of Wales. That has never happened. I did not say that. She also wrote that it is my lifelong dream to play Kate Middleton on The Crown.
I was gonna ask. I was like, rumor has it that you're auditioning for the crown. I don't go into like 3 hours of investigative journalism on like the people we interview, but I was like, oh, look at this.
It pops up. Yeah, pops right up.
Yeah, it does.
I'm just hoping to get some other press so that it'll just move down, but we'll see.
Thank you, Molly. You're incredible. I really appreciate the time, and we'll be in touch soon. And I think we'll be helping on the clinic as well. So we'll be in touch. We'll be talking.
Yes, I'm so glad. All right. Thank you so much. We'll talk to you later.